joined by Joseph Chalil. He is representing in India right now. He is in Delhi as a member of American Association of Physicians of Indian Origin. But most important, Dr. Chalil, is the book that you have written, Beyond the COVID and related book. What is the finding that you have found in that book, and what you can say to our Indian audience here?
See, one thing which we learned from the COVID is that whether it is the American president or the Indian leadership, including the Indian president, the Canadian president, the British prime ministers, they have all the security. We spent millions of dollars protecting them with the Black Cat commandos, with missiles, but they all got sick by COVID. So no matter how protected the leader is, COVID is one thing which showed that the strategy which is currently being doing wasn't been working. We also, in America, with all these fancy, expensive hospitals, we didn't have masks for our doctors. We didn't have PPE kits. Same thing like what happened in India, same thing happened in America. So we realized that having just one country, which is China, supplying entire world's masks and supplies to the healthcare system wasn't working. So things need to change. So we wrote a book about what is going wrong, what can we do to change it, and what can we do to prepare for the next pandemic. So we thought about we have to bring manufacturing back home. We need to train our doctors into managing patients better. We need to prevent or WHO or some associations like that being hacked and taken over by one country, China. And we know that COVID came from China. Whether it was accidental or it was purposeful, we don't know. But either way, now they're suffering because of it. But there's a better way we can protect ourselves. They had a 10-point plan to protect the world from the next pandemic.
While writing this book, what is the blueprint that you wish to tell to your Indian brethren that they should be careful or wary about?
I would say you're lucky to be in India because we have accessible vaccines. With all people are making it. We have accessible even cancer drugs coming in. I know we talked about it, but there are companies like NATCO, Indian companies, making generic cancer drugs. Whether it's legal or not, they're making it happen. They're giving it free to the patient who deserve it. There are good companies in India who can make this happen. So if India wants to do it, India can do it. We can actually be the healthcare provider for the world in the future. I believe Indian doctors, and we are now the largest, group of foreign doctors in America. In the future, there's a huge shortage coming up in not just in America, but in Germany, in France, in UK, and India will be the one providing healthcare to the world, whether it is through telemedicine, technology, or providing our medicines to them, or bringing the patients back to India. So multiple ways, we will be providing care to the entire world. So be proud, take care of your health. I think one thing we don't do, we don't exercise enough and we don't eat right. I love Indian food, but thing is we need to eat in moderation and work out a little bit and just take care of our health and be good to other people.
One small question, I mean it is also a clarification that I may ask you, is that generally it was said that malnourished people had little respite from COVID virus because malnourished are more attuned to fighting the virus than the people at large who are well off.
It may not be malnourished. The people who are overweight were worse off with COVID. People who died were more heavier than the people who did not die from COVID. As you can see, this is the true all over the world. So if you are being healthy, one thing which I'm not sure anyone told about it, our president, the president-elect, Anjana Samada, was stuck with COVID in ICU. We almost thought she will die. So she came back, after being on ventilator for weeks, back to life to lead the organization. That is a big deal. This is the time, I don't know, we talked about it today. When we see her as a miracle baby. Like we thought she was going to die. And she came back up, from a ventilator for weeks in ICU. So one thing what I would say is you cannot control everything in the world. What you can control is what you eat and what you do with your life. Take a break, go for a 30-minute walk, nothing longer, and eat less rice. That'll be good.
Dr. Joseph, thank you very much for sparing time and clarifying few of the fallacies and talking to what COVID was all about, and giving an insight about how one could take a preventive action lot more than the other diseases that are also around the corner. COVID is only one.
Yeah, one more thing to say, that we have a new book coming out for India. It's basically with Professor Madhav Nalapat from Sunday Guardian and Professor Ambassador Pradeep Kapoor are co-authors of this. Again, we're proposing like a 10-point strategy for India to be prepared. Number one would be, again, how do we change our way that we teach our medical students, into the next type of it. So now we're leading G20. We should be preparing our doctors to be the G20 doctors, not just Indian doctors. So if we can train them better. Number two, we can have, mobile assets. Like for example, America has ships which are hospitals. Why can't India have ships which are hospital ships? We can move it to Visakhapatnam or Cochin or Mumbai port when it's needed, because COVID doesn't happen everywhere at the same time. It happens in clusters, or it could be another next pandemic. This is not the last pandemic we're going to have. We will have more pandemics, we'll have more war, but we need to be prepared. Now we need to start making stuff in India. So one thing which happened right is that before COVID, India was not making any masks or PPE kits. We started making it in every houses, in cottage industries. Now we are the largest manufacturer. We started making vaccines. So we can learn from it. We can be self-sufficient. We can't depend on China. We can't depend on Europe or America for the future. We need to be self-reliant. We have smart people, all of you. We're the smartest people in the world.
Dr. Joseph, what our Prime Minister keeps echoing, Vasudhaiv Kutumbakam, you have touched upon that. You said we need G20. We are presidency. India is holding the presidency of G20. You talked about G20 doctors. That is a very good positive sign, and I assume the people in power, people in the health ministry and people in government of India will take note of your clarion call about India as a hub for medical practice or medical treatment to the world at large. Thank you, Dr. Joseph, for talking to us, and congratulations for the new book that is coming up. All the best.
Thank you so much. Thank you for having me.